Hello, everyone. Good morning, good afternoon, good evening, depending on where you are joining us today on this webinar on self-care of mild COVID-19 symptoms, dispelling the myths. My name is Gonçalo Sousa Pinto. I'm lead for practice and development and transformation at FIP, the International Pharmaceutical Federation. Sorry, I'll be your moderator today at the webinar. And I'll be joined by three excellent speakers from FIP in different positions. We'd like to thank our partner for this webinar today, Reckitt Benckiser, for supporting this event and making it possible. Thank you very much. Just a few introductory notes. We will be having this program today. We will start with Jaime Acosta Gomez from Spain, who will be speaking on COVID-19, preventing the spread of the disease and understanding its symptoms. This will be followed by Chris John, who will be addressing the topic of dispelling myths about self-care treatments of COVID-19. And then Lars-Åke Söderlund from Sweden, who will be addressing how to manage mild symptoms of COVID-19 and present a self-care case study. We'll then have change into an interview format and a panel discussion and address some of your questions as well to any of the speakers. But before I give the floor to any of the speakers or to our speakers today, I'd like just to share with you some introductory notes on the topic of today's webinar. As you all know, COVID-19 first made it to world news in early 2020, just about 10 months ago. And over this time, a gigantic research effort has been made worldwide to understand and get to know this new virus and the disease it produces, COVID-19, and also how to prevent this disease, namely through safe and effective vaccines, and also to treat the disease. And healthcare professionals from all professions within the healthcare team have navigated a very challenging time of uncertainty, of lack of evidence, of changing evidence on a daily basis almost, and also, of course, of new data coming from experimental treatments. And this lack of knowledge or poor knowledge or uncertainty has also led to the circulation of conspiracy theories, to hoaxes and fake news and myths, and also even advice that had no supporting evidence on the internet, on speeches and social media and in various channels. And we've even seen politicians at the highest level making statements on treatment options that lacked any appropriate evidence base and were outright dangerous, ranging from use of household disinfectants to medicines that have proven not to have any significant therapeutic value against COVID-19. And this has led the World Health Organization to classify this phenomenon as an infodemia in parallel with a pandemia, and which has produced confusion and anxiety in many individuals as well as communities and even policymakers. And as we all know, although the most severe cases of COVID-19 are largely managed by hospitals and intensive care units, a large number of cases that are mild and they are treated in the community at patients' homes in quarantine or isolation. And community pharmacists have a crucial role to play in the overall response to COVID-19 at the primary healthcare level by improving health education and literacy, promoting disease prevention and the use of personal protective equipment. And in several countries, their role extends to testing asymptomatic patients and also to the administration of vaccines as soon as vaccines are available in the near future, not only against COVID-19, but also to several other diseases, including the seasonal influenza. Pharmacists also play a very important role in supporting symptomatic relief in mild cases of COVID-19 in the community. And therefore, it is essential that they have, or we have, a good understanding of the evidence base for the available treatments and measures to manage those symptoms in the community in order to adequately advise patients and their carers. This is why we've organized this event, and that's what this webinar is about. We are honored to have 3 excellent speakers who will provide us with an overview of the evidence and dispel some of the most common myths associated with COVID-19 treatments. So it is just a few announcements in practicalities related to this webinar. We are recording this event and we are live streaming it via Facebook. And the recording of this webinar will also be available on our website and social media channels. And you may ask questions using the question box provided. And please note that there are 2 different tools. One is the question box Q&A, and the other one is the chat box that you will also have the opportunity to use for comments and for interaction. You're also welcome to provide any feedback about this webinar and how we may improve our webinar events and online presence by sending an email to webinars@fip.org. And we do invite you to become an individual member of FIP at our website, fip.org/membership_registration. So the aim of today's webinar is to describe an evidence-based approach to self-care of mild COVID-19 symptoms. And some of the learning objectives we have defined for this event include describing approaches for preventing the spread of COVID-19, listing symptoms of COVID-19, similarities and differences to influenza and even to common colds, identifying myths associated with self-care of COVID-19, describing how mild symptoms should be managed, and discussing when to refer more serious cases to other health professions and healthcare facilities, escalating the care of COVID-19. And it is now my absolute pleasure to introduce my friend and colleague, Jaime Acosta. Jaime is a community pharmacist from Madrid, Spain, and he has played a significant role over many years on different levels in FIP. He's an experienced community pharmacist with a strong passion for the future of pharmacy and a deep understanding of the community pharmacy's environment, as well as healthcare's new and changing needs. His leadership and skills have been recognized twice by the WHO with WHO Armstrong Institute, Johns Hopkins Medicine Scholarship 2013, and the WHO Scholarship Grant for Upcoming Leaders in 2011, and also by the FIP when we bestowed an FIP Fellowship Award in 2020. Jaime, the floor is yours. Thank you very much.
Thank you, Gonzalo, for the very kind introduction. Thank you to the FIP for having me to share this information with you colleagues from all around the world. I would like to thank you for your excellent service. Community pharmacy has risen to the challenge. We can be very proud of what we've done. We saved the day when everything was collapsing. Community pharmacies open punctual to service our patients, not only dispensing, but only providing the right information to the right people. We save lives, and it's because of you for your regular work. So thank you for that. It is my pleasure to be with you to share this very vital, important, basic information about COVID-19 and the work that we can do in our pharmacies. So next slide, please. Thank you. So we are kind of used now to COVID-19 and understanding its symptoms and providing practical advice to our patients, to our customers. Social distancing, I would say, is the most important rule to follow, at least 1 meter, according to WHO. It's very important to wash hands often to not transmit the virus. Using hand sanitizer when proper washing is not available. Covering the mouth and nose with tissue when coughing or sneezing. And also very important, putting used tissues in closed bin if possible, and wash hands. I would like to remind you the need of using closed bins in the pharmacy for your patients, so they can put their tissues or their masks when used. Some countries are servicing their patients by collecting used masks. And also it's very important to properly use face masks. As with medicines, masks alone do not help if they are not used properly. And there are some very basic rules that we all know, and it's important to remind them to our patients. It's very important to have hands clean before touching the mask, so we do not contaminate them, especially in the inside. Inspect the mask for tears or holes, otherwise they wouldn't be valid. Find the top side to properly adjust it to the nose with the metal piece or the stiff edge. Ensure, this is very important for medical masks, that the colored side faces outwards, so it filters the air that people exhale properly. Place the metal piece or stiff edge over your nose. This is super important because masks need to cover properly the face, the nose, the mouth. Adjust it without leaving gaps on the sides, which is very common. I see it very often in my pharmacy that people have a mask on, but they are exhaling air outside, which is not filtered, and it's very important to remind them this. Although everyone thinks that they use the mask properly, we know that that's not the case. It's very important to avoid touching the mask or when wearing it. And removing the mask from behind the ears or the head. Keep it away from the patient and surfaces while removing it, and discard it after use when the masks need to be discarded into a closed bin, and super important, washing hands after that. Medical masks must be worn health workers as community pharmacists. People in special risk groups that cannot observe social distancing. We'll get into that a bit later. Those people that feel unwell or have COVID-related symptoms should wear a medical mask, or those caregivers that are caring for a suspected or confirmed COVID patient. Fabric masks are okay according to WHO. When COVID-19 is widespread, or when physical distance shorter than 1 meter cannot be observed, to those people that I did not refer just previously. Children under 5 years old are not required to wear masks because they probably are not going to wear it properly. But they should wear it if they are sick or have symptoms. Children between 6 and 11 years old, as recommended by national or regional guidelines, and children over 12 years old should be treated as adults in regards of mask wearing. So they should follow the same rules as adults. Next slide, please. Of course, prevention is the most important thing for not contracting COVID. The best way to prevent illness is to avoid being exposed to the virus. Virus is spread mainly from person to person, between people in close contact with one another through respiratory droplets when an infected person coughs, sneezes, talks loud, sings. Droplets may land in mouths or noses of nearby people, or inhaled into lungs. And recent studies suggest the importance of symptomatic people spreading the virus. It is very important to avoid the 3 Cs, avoid closed and crowded places that involve close contact. It's always advised to meet people in the outside. And if you cannot observe this rule, it's always important to ventilate, open windows, and use masks. Next slide, please. We're seeing the new developments unfold in front of us. There are many things going on. That's why the FIP published very recently an addendum to the COVID guidance document. It's available for you publicly in the FIP.org website. You have there information about remdesivir, plasma, the new vaccines. But very briefly, there are at least 44 candidate COVID vaccines under clinical evaluation according to WHO. There are already 2 vaccines approved by the Russian Federation's Ministry of Health. Neither of them has entered phase 3 clinical trials. And there are being lately, very recently, very positive news about recent vaccines, Pfizer, BioNTech. We have not seen the clinical data yet, but according to what they have published, they say that it's not 90% effective, it's 95% effective. Just a few numbers of this. They are running a phase 3 clinical trial with 43,000 people enrolled. And up to 28 days after the first dose, they confirmed 170 cases of COVID-19. And the very important news, very promising news, is that 162 people were in the placebo group of those sick patients, and only 8 were in the vaccine group. And very interestingly too, there were only 10 severe cases that happened only in the placebo group. Of course, we have to be very cautious with this information, but it looks very, very promising. Moderna had similar clinical data from what they have published, and also the University of Oxford and AstraZeneca, up to 90% effective. So it seems that at last we are beginning to see the end of the tunnel. And of course, we know as pharmacists that it's not, we don't need only effective vaccines, but we have to have people vaccinated. And it's very important as healthcare workers in very close contact with people. Our patients trust us. And it's very important to, and we'll talk about that later, to talk about the safety of and effectiveness of these vaccines, because it wouldn't be useful at all, of course, if people chose to not be vaccinated. So as healthcare workers, it's our role also not only vaccinating when we're allowed, but also advocating for proper vaccination. Next slide, please. So symptoms, this is not an exhaustive list. There are a few other symptoms that are not listed in this list. The most common symptoms are fever or chills, cough, fatigue, and which is very interesting, the loss of taste or smell. People should require immediate medical care when they find shortness of breath, or difficulty breathing, or they have chest pain, or they lose speech or mobility, or they have confusion. In these cases, we must advise people to look for emergency medical care. There are other symptoms as muscle or body aches, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea, and many others. So we have to be very cautious when counseling people about their symptoms. Next slide, please. COVID-19 can progress sometimes very fast from even asymptomatic patients to critical failure. So mild to moderate patients have mild symptoms as the ones that I said in the previous slide, up to very mild pneumonia. They can get into a severe severity, when they have dyspnea, hypoxia, or have more than 50% of lung involvement on imaging. It's critical when they, of course, have respiratory failure, shock, or multi-organ system dysfunction. Of course, this may vary, but some patients rapidly deteriorate 1 week after illness onset. We are still learning about COVID-19, and we also have those patients that suffer like a very long illness with body pain, and they are very tired. So we have an opportunity with these patients to help them with their symptoms. There are some risk factors for going into the severe illness, COVID illness, age, and comorbidities, which are listed in the next slide, please. So people have to be especially cautious when they are 60 years or older, or they have other comorbidities to COVID-19, especially lung disease, diabetes, chronic kidney disease, liver disease, neurological disease. They are immunosuppressed or have cancer, or they are obese. And next slide, please. So we are almost in the northern hemisphere, entering into the influenza season. Because of the health measures that people are taking, there is a very much decreased influenza activity. It's historically low. Despite that, we must advise patients to have their influenza vaccine when needed, according to the national or regional guidelines. So when people come to us saying that there's no influenza, we must really advise them to have them vaccinated, as they would have been any other regular normal year. So both illnesses are both contagious, respiratory, but they are caused, as you know, by different viruses. COVID-19 has shown to be spread more easily. It can cause more serious illnesses, as described before. It might take longer for people to show symptoms, if they show symptoms at all. People are contagious for longer, and actually and currently there's no vaccine in widespread use. That's why it's being so difficult to manage this illness. Symptoms of flu and COVID-19 are pretty much similar. It's very difficult to differentiate them. It's almost impossible unless people have a test done. But interestingly, as I said before, different from flu, COVID patients may include a change in or loss of taste or smell. Next slide, please. So this is very important. We are in the heart of the communities, and we know well our patients, and not only our patients, but their social surrounding, and we can provide very important, meaningful advice for them and for the loved ones. We should explain the full range of symptoms of COVID-19 and what they can expect in the development of the illness. And if they have mild symptoms or they are asymptomatic, to let them be aware of how to act if they develop more severe symptoms. They should stay at home and self-isolate, even if they have minor symptoms such as cough, headache, mild fever, until they recover. This is very important to cut the transmission of the illness. If they have high fever, cough, and especially difficulty breathing, they should seek medical attention. In some jurisdictions, in most of them, there are telephone numbers available for them, so they do not have to go and expose others and themselves to health centers where they might find other COVID-19 patients. They should keep up to date on the latest information and advice on what people in their area should be doing to protect themselves. It is very important to explain them how to take care of themselves, but also to protect other people that live with them, as isolation, hygiene, use of masks, disinfection of frequently touched surfaces, using dedicated dishes, cups, bed lines, bed linens, towels. As I said before, monitoring of symptoms, how they should wash their hands and clothes with hot water, using a separate container. So we are doing this all of the time, and that's why I think we are doing a difference. It's very important to not only let people know when they should go and when they require immediate emergency medical care, but also very important to know when they do not need them, so they do not go without a need to a healthcare center or a hospital and exposing others and themselves. Next slide, please. So, as we all know, as I said before, community pharmacists' response to COVID-19 has been very important throughout the world. We have ensured adequate supplies of medicines, protective equipment when available, thermometers, sanitizers, etc. We have supported the continuity of treatments. We'll get into that a bit later. Not only when renewing prescriptions, so people did not have to go back to their prescriber, to a physician, but also delivering medicines were allowed and were appropriate. We have followed and contributed to these different strategies in place in different countries. We have informed and educated the public. We have counseled, referred when appropriate. We have promoted the disease and infection control. We are vaccinating or contributing to adequate vaccination coverage right now with influenza and other illnesses. But in the future, when vaccines are available, we'll be vaccinating in some countries to people against COVID-19. And in some places, many places, we have compounded hand sanitizer when it was not available. Because community pharmacists represent the first point of contact within the health system for many communities. We have been the only healthcare professional available in many places, not only in rural communities, but we've done a very important job. In several countries, pharmacists have partnered with the government to ensure an optimal supply of face masks, and were encouraged to detect symptoms and refer patients when necessary. In my pharmacy, for example, we have supplied face masks with the electronic prescription tool. So we were sure that people received the masks they needed, and we reached most of the population, not only providing them with the masks they needed, but with the right information about how to use them. In several countries, there is some research published by Okureki and colleagues. They describe the roles played by community pharmacists, educating populations on safety and infection prevention recommendations, as well as answering inquiries regarding investigational treatments, and also debunking myths and providing also very important mental health support to patients. Next slide, please. In the face of shortages because of lockdowns, stress in supply chains, higher demand of medicines, national medicines that have prevented medicines to be exported, pharmacists have also been called upon to participate in ensuring adequate supply of health products and medicines. For example, in Australia, community pharmacists have been allowed, because of COVID-19 pandemic, to substitute medicines when the prescribed medicine was not available. And this has been a very important professional role. It has happened in other countries. In Egypt, for example, the majority of respondents to a questionnaire run by Balol and Dewey and colleagues, the majority of respondents reported high rates of protective personal equipment, medicine provision, and mask distribution, which has been very important. 8.8% of Egyptian pharmacists surveyed reported suspected COVID-19 cases. Regarding vaccination, as I said before, particularly in the USA and Brazil, pharmacists will be allowed to vaccinate against COVID-19. In the USA, pharmacies are a very important part of what they have called Operation Warp Speed, to provide fast supply and administration of the vaccine once available. It depends, as you know, on the storage conditions, and they may vary between the different products from -80 degrees centigrade to maybe temperature, room temperature, in case the product is resistant to regular conditions. So we'll see different conditions from different vaccines once they reach the market. And also, I would like to add the role that community pharmacists have in different countries with testing. Again, trying to offer an available help, longer opening hours in the heart of communities to people who do not want or cannot go to a public health center to be tested. Next slide, please. In different countries, as I said before, there are new professional activities and expanded scope of practice because of COVID-19. For example, minor ailments, even through video consultation in Wales, people go to a pharmacy to have when they have a minor ailment, and the pharmacist assess them and even dispenses product, sometimes free of charge, subsidized by the government. Interestingly, for example, in England, now community pharmacists are referred patients through the phone from the NHS 111, which is the emergency phone number. So community pharmacists are assessing through the phone patients when referred from the system. Also, pharmacists throughout the world have expanded their prescribing roles to ease the access to the medicines that patients need. For example, in Ireland and Portugal, pharmacists are extending the prescriptions. In Australia, pharmacists have been allowed to dispense in case of emergencies, and in Scotland, even community pharmacists have been allowed to dispense even controlled medicines when there was a prior prescription. So community pharmacy have expanded their role throughout the world. Next slide, please. In Canada, which I think is one of the most advanced countries regarding to community pharmacy practice, community pharmacists are able to renew or extend prescription for continuity of care. They can change drug dosage, formulation, or regime. They can provide a therapeutic substitution. They can assess and prescribe for minor ailment conditions, as I said before. They can prescribe in the case of an emergency, and in most of the regions in Canada, they can administer vaccines. And also they are expanding their role regarding distant services. For example, in Ontario, which is a region in Canada, They can provide a virtual meds check, which is a service quite related to medicines use review, and they are paid 60 Canadian dollars per claim or 25 Canadian dollars for follow-up. And in Alberta, they can assess patients when they are asked for COVID-19 symptoms on a virtual service, and they are paid 20 Canadian dollars per claim, up to a maximum of 5 claims per pharmacy per day. And next slide, please. And because of the need of having these distant services in place, in Scotland, community pharmacies are using a tool from the National Health Service that use other healthcare practitioners, which is called the Near Me, NHS Near Me, which is a video consultation service. And in Australia, pharmacists, as I said before, can urgent supply a long-term prescription medicine in the absence of prescription, and even have it delivered to some specific patients. And in this case, this delivery is funded by the government. So this is all from me. Over to you, Gonzo. Thank you.
Thank you very much, Jaime, for providing this overview of the symptoms and the preventative approaches to COVID-19, and also an overview of what pharmacists have been doing in terms of new services or the expansion of existing services to respond to the pandemic. Excellent overview. Thank you very much. We will now have a presentation by Christopher John. Chris is a registered pharmacist in the UK and spent 25 years in its National Health Service working in hospital pharmacy in clinical and managerial roles, education and training, especially regional services, and workforce planning for the NHS Workforce Review Team, Centre for Workforce Intelligence. Chris was also head of workforce policy and projects at the Royal Pharmaceutical Society from 2011 to 2020, working on thought leadership, consultation responses, and standards and guidance relating to workforce. Chris has been an assessor of the Office for Students, England's university's regulator, Teaching Excellence Framework, which assessed the quality of teaching and outcomes for students studying pharmacy, medicine, nursing, and other healthcare subjects at universities. Chris was also the FIP Workforce Development Hub lead for Workforce Intelligence, and he was part of the core team that produced the FIP development goals and was involved with updating the FIP COVID-19 treatment guidelines. Finally, Chris is also my colleague on the FIP headquarters team as lead for data and intelligence. So thank you very much, Chris, and the floor is yours.
Thank you, Gonzo. This next section of the webinar is entitled Dispelling Myths and Answering Questions about Self-Care Treatments of COVID-19. We've heard from Jaime that pharmacies have a pivotal role to play, not only ensuring access to medicines and medical devices, but also in public health, namely by informing the public about preventative measures, advising about behavioural precautions, and in the risk assessment, early detection and referral of individuals suspected to be at high risk of being infected from COVID-19. Pharmacy staff may face myths or questions, and so they need to be ready to deal with them utilising available evidence. Next slide, please. This diagram is from the World Health Organization. You will see we are faced day after day by a huge amount of COVID-19 information. Not all of it's reliable, and you will see that sometimes, like the virus, myths and rumors can multiply and grow into a very large number and take hold as being true. So we as professionals need to be very on top of this and There are some tips shown in this diagram about telling the difference and stopping the spread of misinformation. So particularly by not spreading any rumors in group chat or checking that news is from trusted sources, or double checking facts, and just generally being aware of where the evidence is. Next slide, please. Part of FIP's response to the COVID-19 pandemic is to help out with this evidence, and following the WHO's declaration of the outbreak as a public health emergency of international concern on the 30th of January, FIP set up a task force to develop emergency guidelines to support the pharmacy workforce around the world in helping to minimize and control the outbreak, and in providing advice and care to patients and communities. So the guidelines have since been updated 3 times, and you would have heard Jaime mention the last update was this month with an addendum that we've just released. The task force included representatives from all practice settings and had science input as well. Next slide, please. So the guidance is available on the FIP website in 15 languages and includes the following documents: clinical information and treatment guidelines for COVID-19. And as this states, it's about the disease and its treatment. There's also guidelines for pharmacists and the pharmacy workforce. This includes roles and responsibilities of community and hospital pharmacies, as well as guidance on many activities from infection control to patient isolation and referral. There's also frequently asked questions and myth busting, and the FAQs include information about the virus, how it is spread, and care of infected patients. We'll be looking more closely at the myth busting during this webinar. There's also COVID-19 additional resources, which include holding statements and resources from our member organizations, of which there are many. And finally, we've got summary sheets, summary guidance sheets, everything from pharmacy operations to the use of masks. FIP also developed a dedicated web page and resource center, and you can see the link there. Next slide, please. And this is what the web page looks like. So please do explore it. You can also check out the other FIP COVID-19 webinars that we have delivered. That's also on the website. Next slide, please. So there's a program of digital events responding to the pandemic together, and an online platform on Facebook for pharmacists to discuss and exchange queries and experiences, and other initiatives with more than 30,000 members. There's a repository of valuable COVID-19 related resources, as I mentioned, developed by FIP's member organizations, but also other allied partners, such as the World Health Organization. And there are statements and scientific, technical, or professional positions on various issues. An example might be the use of hydroxychloroquine for treatment of COVID-19. Next slide, please. So looking at dispelling myths and answering questions about self-care treatments of COVID-19, as things stand now, there is no magic bullet. There are no medicines that can prevent or treat COVID-19. We are completely reliant on public health measures, such as the ones Jaime mentioned earlier, aimed at preventing the spread of the disease. Now, of course, we've got vaccines in the pipeline, but at the moment, there is not a vaccine that is available for prevention, but hopefully that will be coming soon. And this slide shows you a poster from WHO, which states that to date, there are no specific medicines recommended to prevent or treat coronavirus. So as I say, it's about preventing spread of the disease. So as I mentioned, questions may get asked, and some will be myths, some will be out of the need to improve knowledge. And we have a lot of this information On our website, the WHO also has a very good section on myth busting. One question you may get asked is, are pneumonia and flu vaccines effective against COVID-19? Well, vaccines against pneumonia, such as pneumococcal vaccine and Haemophilus influenza type B vaccine, do not provide protection against the new coronavirus. They, of course, provide protection against those diseases. But this coronavirus is so new and different, it needs its own vaccine. We've heard some vaccines are in development, and that's a very hopeful thing that we have, but until they're freely available, we don't have one. Although these vaccines are not effective against COVID-19, they are, of course, effective against other respiratory illnesses, and they're highly recommended to protect health. So another question you may get asked is about saline nasal wash. There's actually no evidence that regularly rinsing the nose with saline has protected people from infection with the coronavirus. There is some limited evidence that regularly rinsing the nose with saline can help people recover more quickly from the common cold. However, regularly rinsing the nose has not been shown to prevent respiratory infections. Other pieces of information that were circulating earlier in the pandemic were that high or low temperatures might prevent its spread. But the COVID-19 virus can spread in hot and humid climates, and there's no reason to believe that cold weather can kill the new coronavirus or other diseases. The normal human body temperature remains around 36.5 to 37 degrees C, and regardless of external temperature or weather. So the most effective way to protect against the virus is, as Jaime mentioned frequently, cleaning your hands with alcohol-based hand rub or soap and water. Antibiotics do not work against viruses. As we know, they only work on bacterial infections. COVID-19 is caused by a virus, and therefore antibiotics should not be used as a means of prevention or treatment. However, some people treated positive for COVID-19 may receive antibiotics because of bacterial co-infection. So methanol, ethanol, or bleach do not prevent or cure COVID-19 and can be extremely dangerous. They are poisons. Drinking them can lead to disability and death. Methanol, ethanol, and bleach are sometimes used in cleaning products to kill the virus on surfaces. However, you should never drink them, of course, and they will not kill the virus in the body. They will only harm internal organs if ingested. So to protect against COVID-19, of course, disinfect objects and surfaces, especially the ones you touch regularly. And that can be done using diluted bleach or alcohol. But make sure you clean your hands frequently and thoroughly and avoid touching your eyes, mouth, and nose would be the advice to give. Next slide, please. Unfortunately, drinking alcohol does not provide any protection against COVID-19 and obviously can be dangerous to health if not drunk in moderation. Garlic, again, there's no evidence for. It's a healthy food, but and it may have some antimicrobial properties, but there is no evidence from the current outbreak that eating garlic has protected people from coronavirus. UV radiation using a lamp or as a disinfectant on surfaces, again, not been shown as effective, particularly if you use it on the body to prevent COVID-19, and can cause skin irritation and damage eyes. Another myth that was circulating earlier on in the pandemic was that 5G mobile networks could spread the virus, but avoiding exposure does not prevent infection. Viruses cannot travel on radio waves or mobile networks. COVID-19 is spreading in many countries that do not have 5G mobile networks. As we've heard, COVID-19 is spread through respiratory droplets when an infected person coughs, sneezes, or speaks. People Can also be infected by touching a contaminated surface and then touching their eyes, nose, or mouth, but not as was spread by rumor that it was mobile networks. What about supplements, nutritional supplements? Obviously, maintaining good nutrition is important at all times. There is some evidence for the use of vitamin C and zinc for respiratory infections, and they can reduce length of symptoms, but there's no evidence for COVID-19. They're unlikely to affect the immune system. Likewise, anything you've heard around green tea, echinacea, colloidal silver, or not likely to be of help. And you may have heard one, oleandrin, as a supplement that is poisonous. There's also been quite a lot of evidence discussed recently around vitamin D, and there are a growing number of studies demonstrating that having optimal blood levels of vitamin D reduces COVID-19 risks. I think we're still, in many countries, collating evidence on that, but there is an evidence-based building on vitamin D. Next slide, please. To look at particularly COVID-19 and ibuprofen, earlier on in the pandemic, ibuprofen, there was a lot of concern about its use, particularly in patients with COVID-19, and then that it might make the situation worse. But there were a lot of false stories that initiated that, and these are some examples. There were 4 young people in an intensive care unit in Cork who have no underlying illnesses and all were taking anti-inflammatories, and there were concerns that this had caused a more severe illness. This was proven to be false. The University of Vienna sent a memo warning people with coronavirus symptoms not to take ibuprofen because it had been discovered that it increases the speed of reproduction of the coronavirus, COVID-19, in the body. And this is the reason why people in Italy have reached the current bad stage and rapid spread. That was another false rumor. Next slide. There was also another myth from University of Hospital in Toulouse, France, that there are 4 very critical cases of coronavirus in young people who did not have any health problems. The problem was that when they appeared to have symptoms, they all took painkillers like ibuprofen. So they were rumors that were in the media, on social media and other places, that were false. And so it just shows you how this infodemic information can spread. Next slide, please. So as a result, perhaps, of concern around ibuprofen, the National Health Service in the United Kingdom issued on their website on the 18th of March, they initially said there's no currently strong evidence that ibuprofen can make coronavirus worse. But until they had more information, they asked people to take paracetamol to treat the symptoms of coronavirus, unless your doctor has told you paracetamol is not suitable for you. So a similar advice was issued from WHO, European Medicines Agency, and in countries such as France and Italy. So how did this all arise? If we look at the next slide, the theory behind this particular concern was that ibuprofen upregulates ACE2, which is a receptor in cells which increases entry of COVID-19 into cells. It's a particular entry point for the COVID-19 virus, and the upregulation had been found in one animal study, but not in a human study. There was an analogy with bacterial soft tissue infections, that patients with more severe infections because of the immune depressive actions of non-steroidal anti-inflammatory drugs or belated treatment because of initial symptom suppression, that their infections were worse. And fever is a natural response to viral infection and reduces viral activity. So another theory was antipyretic activity would reduce natural defenses against viruses. However, we move on to the next slide, if you look at the evidence, the upregulation of ACE2 was only found in one animal study, and chronic use of non-steroidal anti-inflammatory drugs was not associated with worsening of COVID-19 or actually being infected, and that was undertaken in quite a large study of over 13,000 people. Of nearly 13,000 people rather. The antipyretic effect, suppressing symptoms, increasing risk of severity, would apply to paracetamol as well, if that was one of the mechanisms for worsening of COVID-19 due to ibuprofen. And the increased risk of severe pneumonia in patients chronically on drugs that upregulate ACE2, such as non-steroidal anti-inflammatory drugs, such as ibuprofen, ACE inhibitors, or ARBs, has not been shown. So when you look more deeply into the evidence, the case doesn't look as strong, and in fact it looks fairly weak. And in fact the immunosuppressive effect of ibuprofen and non-steroidals may actually help with the cytokine rush that you get at the beginning of infection with COVID-19, and actually help with that and limit the damage. But of course, we're building evidence all the time. So in April, the UK Commission on Human Medicine's advice on ibuprofen and coronavirus said that its expert working group concluded that there was insufficient evidence to establish a link between use of ibuprofen and susceptibility to contracting COVID-19 or the worsening of its symptoms, and that patients can take paracetamol or ibuprofen when self-medicating for patients for symptoms of COVID-19, such as fever and headache, and should follow health service advice if they have any questions or if the symptoms get worse. Next slide, please. So the current FIP guidelines is there's currently no conclusive evidence to establish a direct association between the use of non-steroidal anti-inflammatory medicines, including ibuprofen, and increased risk of infection or severity of disease of COVID-19. So that's a good example of how to look more closely at information you might be circulating around treatment of COVID-19. And I'll hand you back to Gonzalo.
Thank you very much, Chris. Excellent. Yes, indeed, that we need to pay attention to the evidence for all these myths that are circulating. Some of them are more obviously refutable, but some others are not really and are part of our daily practice. So we need to keep an eye on the available evidence for sure. And it's now my pleasure to introduce Mr. Lars-Åke Söderlund. He's president of the FIP Community Pharmacy section. And Lars-Åke has an extensive experience of working together with the Swedish healthcare sector in improving health and creating a sustainable healthcare system. He has been vice president of the Swedish Pharmaceutical Society and has had a number of executive positions within Apoteket AB, recently as head of national customers and new business. Lars-Åke is president for the Swedish national project Check My Medicines, and he's co-chair of the FIP Congress Program Committee, as well as president, as I mentioned, of our community pharmacy section. He's a frequent speaker in Sweden and internationally regarding the future of healthcare and pharmacy. Thank you very much, Lars-Åke. The floor is yours.
Thank you so much, Gonzalo, for this nice introduction. And thank you, FIP, for inviting me to be part of this webinar. As community pharmacists are an essential actor for self-care, I mean, when it comes to prevention, detection, minor ailments, and also prevention and care for patients with non-communicable diseases, it's a great honor to represent our section here today. The COVID-19 pandemic is putting actually enormous pressure on our healthcare systems worldwide, and various countries are struggling to flatten the curve to prevent their healthcare systems from becoming overwhelmed. And as such, the systems were not really ready for COVID-19. And this has, as we heard, been declared as the defining global health crisis of our time. So the extended practice of self-care among our individuals has helped to ease the strain on healthcare systems and also improve the delivery of treatment in communities and providing vulnerable patients with the care they actually need. So in this perspective, community pharmacies really have been the gateway to care. Next slide, please. Today, we are going to discuss how to manage mild symptoms. And actually, it is a real-time case study where we also will invite you to interact during the session. The WHO defines self-care as the ability of individuals, families, and communities to promote health, prevent disease, maintain health, and to cope with illness and disability with or without the support of a healthcare provider. As we heard also, the WHO unfortunately identified the dangerous consequences of misinformation and misleading or false healthcare information early on the pandemic, calling it an infodemic. So there have been reports of unproven and unsafe practices to prevent transmission of COVID-19, methods that are not only ineffective, but also very dangerous. So it's extremely important to use trustworthy sources like the pharmacy for guidance. Next slide, please. Well, actually, as we can see here on this slide, the self-care continuum is a broad spectrum of activities where actually we can support our patients, both regarding healthy living, but also regarding minor ailments, long-term conditions, and of course in hospital care as well. So it's a broad spectrum of activities where actually pharmacy can contribute to a better life in health. Next slide, please. So the scope of self-care as described in the definition by the WHO also includes health promotion, disease prevention and control, self-medication, providing care to dependent persons, seeking hospital or specialist or primary care if necessary, and rehabilitation, including palliative care. So it includes a range of self-care modes and approaches. And while this is a broad definition that includes many activities, it is important also for health policy to recognize the importance of self-care, especially where it intersects with the health system and health professionals. And WHO also says and states that it is the individual person who acts or doesn't act to preserve health or respond to symptoms. Next slide, please. So this means that self-care is the ability of individuals, families, and communities to promote health, prevent disease, maintain health, and cope with illness and disability with or without the support. So these self-care interventions, they are evidence-based. They are quality tools that support self-care, and they include medicines, counseling, diagnostics, and or, for example, digital technologies, which can be accessed fully or partially outside the formal healthcare services. So depending on the intervention, they can be used with or without direct supervision of health workers. So self-care interventions can increase ownership and empowerment of individuals and communities regarding their health and well-being, strengthening national institutions with efficient use of domestic resources for health that create the health sector innovations, including digital and mHealth approaches, and also improve access to medicines and intervention. And as we have seen during the pandemic, self-care has to a large extent saved our healthcare systems during the pandemic by decreasing the pressure on primary health care and emergency care. Next slide, please. Today, we are going to get to know Mrs. A.B. And this is our COVID-19 real-time case study. We are going to discuss how to manage mild symptoms. And as you all know, self-care health interventions are evidence-based quality assured advice, medicines, etc., which can be provided fully or partially outside the formal health services and can be used without or with the direct supervision of healthcare staff. Mrs. AB, she is 35 years old, and she has actually tested positive for COVID-19. And she has mild symptoms like fever, a runny nose, a sore throat, cough. She has loss of smell, her body aches, and she perceives fatigue, but she has no other risk factors. Next slide, please. So she lives in her home with her partner. He is also asymptomatic and he has no risk factors. Mrs. AB phones her local community pharmacist to ask if it's appropriate that she isolates at her home or should she seek care elsewhere. So now please insert your thoughts and reasons in the chat box. So next slide, please. Mrs. AB calls her local pharmacist to ask if it is appropriate she isolates at home or should she seek care elsewhere. Well, as we learned, she is without risk factors for poor outcome. I mean, age over 60 years, smoking, obesity, and non-communicable diseases such as cardiovascular disease, diabetes, chronic lung disease, chronic kidney disease, immunosuppression or cancer, and is suitable then for home isolation and self-care, providing both infection prevention and control measures are taking, and also monitor for signs and symptoms of deterioration. It's really important that she watch these symptoms because that could be a sign that the disease is actually getting in a more severe state. So next slide, please. So the question is then, what kind of infection prevention and control measures should be taken by Mrs. AB? Please insert your thoughts and reasons in the chat box. And let's move on to the next slide, please. Well, Mrs. AB's partner, he doesn't have any risk factors for poor outcome, but he should actually avoid entering the room Mrs. AB is located in. They should sleep separately. Limit Mrs. AB's movement around the household and minimize shared spaces. She should ensure that the shared spaces, I mean the kitchen and the bathroom, for example, are well ventilated. And they should not allow any visitors until Mrs. AB has completely recovered, no signs or symptoms of COVID-19. And of course, it's very important to perform hand and respiratory hygiene. And Mrs. AB should also wear a medical mask as much as possible when staying inside with her husband. And Mr. BB should wear a medical mask when he is in the same room. So it's very important that the person stays in a separate room as much as possible and keeps the door closed. Avoid sharing, avoid using shared spaces, use a separate bathroom if possible, wash the hands with soap and water often, use hand sanitizer gel, cover the mouth and nose with a tissue or a sleeve and a face mask if necessary, and put used tissues in the bin as we heard earlier. So let's move on to the next slide, please. So what infection prevention and control measures should be taken by Mrs. AB and her household? Well, actually, Mr. BB should avoid direct contact with Mrs. AB's body fluids. Mrs. AB and Mr. BB should not reuse medical masks or gloves. Gloves and a plastic apron should actually be used when cleaning surfaces or handling clothing or linen soiled with body fluids. And also, of course, it's really important to clean and disinfect surfaces that are frequently touched in Mrs. AB's room and share spaces. And Mrs. AB should also use dedicated linen and eating utensils during this time. And they should place contaminated linen in a laundry bag, and also the home waste generated by Mrs. AB should be placed in strong closed bags for disposal. Next slide, please. Well, Mrs. AB, she has mild symptoms like fever, a runny nose, a sore throat, cough, loss of smell, her body aches, and she shows symptoms of fatigue. So the question now to you is, what symptomatic treatment should or can be given to Mrs. AB? Please insert your thoughts and reasons in the chat box, please. Next slide, please. Well, actually, against the fever and pain, the recommendation is ibuprofen and or paracetamol. There was, as we heard from Chris previously, at the beginning of a pandemic, a discussion whether ibuprofen wasn't appropriate for these symptoms, but there is no scientific evidence that ibuprofen is not appropriate. So both substances can be used against the fever and the pain. Next slide, please. So what self-care treatments should Mrs. AB use regarding the cough? Well, she should avoid lying on her back. She should lie on the side or sit upright instead. She could also use simple measures like drinking hot liquids like tea or using honey. And sleeping or sipping on a non-alcoholic drink throughout the day is actually good. Not only will this keep her throat moist and comfortable, it will also help her keep her hydrated. And water is, of course, the best choice of liquid to drink. We mentioned honey, yes, because a little bit of honey tends to soothe a sore throat. So if this doesn't help, she should contact a pharmacist for advice about cough treatments. And of course, she should try to contact her pharmacist online instead of going to the pharmacy. So next slide, please. When it comes to the supportive measures, we should advise Mrs. AB about adequate nutrition and appropriate rehydration. It's important to improve air circulation by opening a window or a door, just to keep the house ventilated. And of course, it's also important to check psychosocial mental health and well-being support to check if any symptoms of insomnia, depression, or anxiety as appropriate. And these supportive measures are important to monitor to check if the situation is actually getting worse. Next slide, please. So how should Mrs. AB be advised about the signs and symptoms of complications, or how to recognize a deterioration in her health stages? Well, actually, worsening symptoms are lightheadedness, difficulty in breathing, chest pain, and dehydration. And emergency warning signs for COVID-19 are these indicators of these sort of severe illness. And anyone can actually develop emergency signs, but they are more commonly seen in people with certain medical conditions like heart conditions, lung conditions, diabetes, liver disease, among others. And also actually what has been discovered in people who are 85 years or older. Next slide, please. So how should Mrs. AB be advised about the signs and symptoms of complications, or how to recognize a deterioration in her health status? Well, as we saw regarding the symptoms, this is, let's see if we have that slide. Yes. If she feels lightheadedness, difficulty in breathing, chest pain, or dehydration, she should, as soon as possible, contact her urgency care facilities for further treatment. And as we said, anyone can develop emergency signs, but these signs are more commonly seen in people with specific certain conditions or the elderly. Next slide, please. So for COVID-19, the following are some examples of emergency warning signs. Sudden chest pain, shortness of breath, or difficulty breathing is experienced. There is blood in their sputum. They have cold, clammy, or pale or mottled skin, or their lips turn blue. They become confused. They are difficult to rouse. They have little or no urine output. And new severe non-blanching rash develops, for example, and COVID-19 symptoms worsen or do not improve within 14 days. So patients with NCDs or weakened immune systems may require referral to primary care physicians. So I would advise that call a healthcare emergency number or for perhaps an ambulance if you or someone you care for are struggling to breathe, are coughing up blood, have blue lips or a blue face, feel cold and sweaty with pale or blotchy skin, have a rash that doesn't fade when you roll a glass, for example, over it, or collapse or faint, or become confused or very drowsy, or have stopped peeing or are peeing not or much less than usual. And don't forget, tell the operator that you actually have coronavirus symptoms. Next slide.
Thank you very much, Lars-Åke, for this very interactive case study discussion that really got us an opportunity to think about how to react in specific situations of patients facing pharmacies or coming to the pharmacy with specific questions of mild cases of COVID-19. Thank you very much. So I would now invite all the speakers to switch their cameras on and microphones, and we have a number of questions that have been addressed to the various speakers through the Q&A tool. We will be going through some of them. We might not have the time to go through all of them. We have about 15 minutes left on this webinar today, but we will address some of the questions now, and maybe some of the others we can either get back to you by email, or we can select the questions that may be relevant to a bigger audience and include them on our website and our resource center. So if I may start with a question for Jaime. There is an extended myth that sneezing is one of the symptoms of mild cases of COVID-19, especially because there has been a strong emphasis on sneezing etiquette. However, sneezing can be a symptom in other respiratory conditions such as the common cold. As the symptoms of COVID-19, the flu and common colds can be quite similar, are there ways or tools for differentiating them in the community pharmacy in order to better advise patients? So how would you establish a difference between the symptoms of the influenza, seasonal influenza, and COVID-19 and a common cold, for example?
Well, we have to be, thank you for the question, Gonzalo. We have to be very cautious in the pharmacy when counseling patients and educating them. Regarding sneezing, you're right that since we all remember when this pandemic began, that one of the first advices was coughing or sneezing into the arm instead of the hands and all the etiquette, respiratory etiquette. So I would first say that we have to be very cautious because our information really has an impact, and it should be given to the good of the patient. In most of the guidelines I have checked, CDC, WHO, sneezing is not part of COVID-19. But I would be very cautious with that because the only tool that is available to really differentiate COVID-19 from other illnesses that have similar specific symptoms is the PCR testing, and point of care testing in some cases were allowed. So I would be very cautious and always staying on the safe side to proper counseling the patients, if that helps. That's what I do in my pharmacy.
Excellent. Thank you very much, Jaime. We have a question from Sudan, and maybe Chris, you can address this one. Patients increasingly ask about the use of traditional herbal regimens for treating COVID-19, especially here in Sudan, the use of acacia seeds. What would you like to comment on the use of traditional or alternative medicines for managing mild symptoms of COVID-19?
Thanks, Gonzalo. There's quite a huge list of potential natural and alternative remedies that people are saying are being used for COVID-19. I haven't particularly heard of that one being used. All I would suggest is having a look at the evidence if you're asked about any remedy and what is its likely effectiveness, but also importantly, what are its likely risks and possible adverse effects. So as I say, that's not one I particularly heard of, but with anything you're asked about those, best to check the evidence base.
Thank you very much. We now have a question for Lars Hopke. As we approach a festive season for several cultures around the world, around the end of the year and the beginning of the new year, some people may believe that if they manage to control the symptoms, they will be healthy enough to spend time with their families and friends. What advice would you give to patients and the community, even if fever, cough, and other symptoms can be temporarily controlled via self-care measures and medicines?
Thank you, Gonzalo. Well, we all know that the incubation period, I mean, the time between getting infected and developing symptoms seems to be between 2 and 14 days. And most people develop symptoms after around 5 days. But of course, individual cases may deviate from this pattern. So I would say that even if you manage to handle mild symptoms by the use of, for example, non-prescription medicines, one shouldn't physically celebrate Christmas with other people. Of course, we need to follow the recommendations and guidelines from the national authorities like the National Centers for Disease Control. But in my opinion, you should avoid any large social gathering such as parties, weddings, Christmas celebrations, and other events attracting many people at the same time, because you can actually be a carrier of the virus and without any symptoms at all. And probably in these cases, the amount of virus is very low and probably also less contagious, but still I would recommend them to have that gathering or that party at another time when you actually have recovered from your disease.
Thank you very much. Another question is regarding the eyes as an entry point to for COVID-19, for the virus in the body. Initially, there was a lot of emphasis on protecting the eyes with goggles and glasses, but that seems to be less much the focus on preventative measures now. Maybe Jaime, could you address that question? Are the eyes really a high-risk entry point for the virus into the body, and should we take more measures to prevent it, that form of contagion?
Thank you for the question. Although it is possible to contract COVID through the eyes, of course, and it's in every single guideline. It's not as likely as other ways of entrance as the respiratory when breathing. So it is recommended to use eye protection for pharmacists when they are in contact with close contact with patients. Probably not all the time in community pharmacy. So it is recommended only for healthcare professionals who are in such a close contact. However, we still see people on the streets with eye protection. And a few months ago, when all this began, now they are not doing, but my staff used to wear eye protection. It was okay with me as a pharmacy owner, because it gave them peace of mind, and they were giving the best. So it was okay for me just to let them have that extra protection, but it's not recommended in the regular guidelines.
Thank you, Jaime. That was very clear. Chris, we have a couple of questions on treatment options, and one of them is, what is your opinion of administration of 500 milligrams of azithromycin for 6 days associated with high doses of vitamin C? My personal opinion, this is Mr. Besim Muzaki, and my personal opinion is that using an antibiotic like azithromycin during COVID-19 treatment is very helpful in preventing opportunistic bacterial infections, which are mostly are present in cases of pneumonia during COVID-19. Maybe could you comment on this and link it to the possibility of antimicrobial resistance, and link it to the treatment of the management of COVID-19? And once you have the microphone, there has been some questions as well about the use of paracetamol, whether it can make COVID-19 mild patients worse. I think you addressed this in your presentation, but if you want to provide any additional clarification, thank you.
Yes, with relation to the azithromycin question, and thank you for the question. I think it's been potentially used in combination in some trials. I have not read of any evidence of using it to prevent or treat coronavirus. And obviously, as Gonzo stated, we've got a big worry about antimicrobial resistance at the moment. So unless there is a suspicion of a coexisting bacterial infection, I personally have not and could not state any evidence for its use. So it wouldn't be something I would be recommending if you ask me. But as I say, I have not seen any evidence. So that would be my answer on that one. And as I say, with the paracetamol, the theory is in lowering the temperature, it reduces the body's natural defense against the virus. So the heightened temperature potentially can reduce viral replication. So again, I think from the presentation, we can say that there hasn't been any substantiated evidence that paracetamol worsens COVID-19 or indeed provides a gateway. So as long as no other contraindications or issues, then safe to use.
Excellent, thank you very much, Chris. And how are we doing time-wise? A couple of minutes more. Just one final question, and this one maybe for Jaime. It has to do with hand hygiene, and it's a double question. Can I understand that a minimum 60% alcohol content is sufficient to disinfect the hands? And the other part is, which way of hand hygiene is more effective? Hand washing with only plain water when no soap is available, or using alcohol-based hand rub or sanitizer? What would you recommend?
Thank you for the question. Again, this is a very important and relevant question for our practice. First of all, when washing hands with water, you need to have soap, because that's it deactivates the virus. Otherwise, you're not sure that your hands are clean after that. So if you do not have soap available, it's preferred to have hand sanitizer with 60% of alcohol at least. Interestingly, it's very important also to follow the proper hand washing technique, which is available in the WHO, CDC, and myself as a pharmacist, I used my Instagram to do a recording a video washing my hands with ink, so people could see how following the proper indications, my hand was fully covered with the ink, supposing it was hand sanitizer. So I think that has helped people too. That's another role for us, being online, supporting our patients.
Excellent. Thank you very much. We still have over 30 questions in our Q&A box, so unfortunately we won't be able to cover them all. I've read through all the questions, and actually for several of them, I think that the FIP guidance on COVID-19 and the frequently asked questions that we include there actually provide an answer and some elements to understand these questions. So I would invite everyone to have a look at those resources that are available on the FIP website in several languages as well. And otherwise, we will address these questions either by email or by including them in the next iteration, the next version of our guidance for the profession. So just a final wrap up, and to thank our speakers today for the excellent presentations and providing an overview of the evidence available for managing symptoms in mild cases of COVID-19 in the community. Community pharmacies are trusted sources of advice and information on health measures and treatment options, and it is essential that we as healthcare professionals keep up to date with newly available evidence, so we can adequately advise the community on how to prevent disease and also to manage symptoms and to support the responsible and well-informed self-care. FIP will continue to support our member organizations, our individual members, and the pharmacists in general, the profession around the world, through our publications, our online events, and our openly accessible COVID-19 resource hub. So I would do invite you to make use of these resources, not only to learn from colleagues around the world, but also to share your own best practices and your concerns. So without further ado, we bring this webinar to close, and we thank you for participating. We had a huge number of participants, so this shows that there is a lot of interest on this topic, and we thank you for your active participation and your questions. And one final word of thanks to our sponsor, Reckitt Benckiser, and also to our 3 magnificent speakers today. Thank you and have a good day or evening or night. Thank you.